separates in the right and left and it doubles up the structures. But yeah, I mean, we should be able to get through this fairly efficiently. So I pretty much will flip back and forth to try to get through, each structure. For the most part, I kind of know what it is in the list, so if I don't flip back and forth, please don't hold it against me. Sometimes I'll leave it where we are, especially if I need to try to get through that item a little bit faster. All right. So this is a sagittal head model. I do have a couple of different versions of this. There's one actually up here. They put it up here on the front. They got one over here. There's a half of it over there. Actually, if you look at any of the digestive system flat boards in that back right corner, the sagittal head model is basically on each one of those. So while we present it here, appreciate the fact that, honestly, these things will appear multiple locations, all right? I don't usually do allocartilage, but the allocartilage is basically the cartilage within the external nose. The external nose is the part of your nose that you see on the surface of your face. It basically helps form the framework that keeps the holes that allow air to enter your external nose open. Those holes, though, you do need to know the name of. It's a little difficult to, I guess, pick up on this, but if you look about right there, that hole that allows air to enter the external nose, that is the external nares. Nares is singular, nares with an E would be plural. So you have the external nares. Once you pass through the external nares, you're in this area right through here, which is located underneath the external nose. This area, kind of like the first area where you enter a building, is called the vestibule. This is the nasal vestibule. It's the entryway. It's a space more than anything else. So you have the nasal vestibule in this area right through here. We kind of trace the path that air would follow. So as you inhale, you pass through the external nares, enter the nasal vestibule, and then you begin to run posteriorly. Posteriorly, you're going to head into the skull. The hole that is connected to your nose within your skull is called the nasal cavity. The nasal cavity. It's basically through this area right here. Okay? Now, inside of that nasal cavity, you will find several structures. The first you probably run into before. They're called the nasal concha or turbinates. There are 3 of them. On the exam, you would need to identify them correctly relative to their location, one to another. If you look over here, you have the superior, middle, and also inferior nasal concha. Let's take a look on the model. I'm going to magnify it a little bit here. There is the superior nasal concha, right through here. It's not as large as the other concha. Below, you have the middle nasal concha, followed by the inferior nasal concha. Superior, middle, inferior nasal concha. For your physiology, you would need to know why they exist. The function of these is to warm, filter, and moisten inhaled air. These bony projections are covered with mucous membranes and also partly hair, so that as you inhale that air, it swirls over them and it sticks and traps particulate matter, and the warmth of the mucous membranes helps warm up that inhaled air. So they warm, filter, and moisten inhaled air. Now I want to show you another model, which is this one here. We only have one of these in the lab, but notice on the right, you do have the sagittal head appearance, correct? So you can still see everything we've talked about thus far. However, over here on the left, this is a different cut. This is a frontal or coronal plane. With the frontal or coronal plane, you can still see the superior, middle, and also inferior nasal concha. So I'm going to zoom in right to this area here. You see this small perpendicular or vertical bone right there? And if you pop over to the other side, it is right through here. It's kind of hard to make out, but it's right here on the right and over here on the left. Those are the superior nasal concha on either side. This projection in the middle, that's the perpendicular plate of the ethmoid bone, right in the middle. If you remember that from A&P 1. So here's a perpendicular plate which helps make up part of the nasal septum. This is the left superior nasal concha. This is the right one over here. See this little projection here? And also here? Those are the middle nasal concha. See how they project? They kind of project out and then curve down. Out and then down, like that. Did y'all see what I did? Mm-hmm. So those are your two middles. And then here are your two inferiors. So again, we have superior, middle, and then inferior nasal concha. Up underneath each concha is a little tunnel or tube-like passageway. Look right in this area here. You see that? There's the inferior curving out and down, but look up underneath right here. This little tube-like passageway underneath is called a nasal meatus. So we're looking at these. Superior, middle, and inferior nasal meatus. The meatus is a tube underneath each concha. The superior nasal meatus is under the superior concha. The middle, under the middle concha, and so forth on. You can see the meatus is here. Like for example, see this is the concha right through there, the bony projection. This tiny little gap, that tiny little space right there next to it, that's going to be the meatus. And you get a little bit of it over here as well, but it's kind of tough to make out over here. I think it's easier when you look at this middle nasal meatus right there. There's its, middle nasal concha right here. Here's the meatus. There's the inferior concha. Here's the inferior meatus right there. There's the inferior concha over here on the right. There's the meatus. Here's the middle concha. There's the meatus right there. All right, so you can see those meatuses. If you looked at the sagittal view like this, actually, that one's a little grainy, so I'm gonna go to this one. You see these little grooves underneath the concha? That's the superior meatus right through here. Up underneath the middle, there, that groove is the middle meatus. And then we have the inferior meatus down below. So the meatuses are tube-like passageways underneath each concha or turbinate, all right? The next structure I want to show you are called sinuses. If you have issues like sinus headaches or sinusitis, these are in some cases going to be the culprit. Sinuses are holes within your cranial bones. These holes, these sinuses help lighten up your skull and also allow for air movement through the skull. All the holes in your skull, whether it's your middle ear canal, and your orbit, your oral cavity, all your holes, all those holes are interconnected. They all connect to one another. All right. So this model here shows you, first of all, the frontal sinus. See the frontal sinus right here in the frontal bone? This opening here is the sphenoidal sinus in the sphenoid bone. You have to see the remaining sinuses here on the coronal cut. If you look like this little tiny gap right there, you see it says like number 14, I believe. That's part of the ethmoid sinus. The ethmoid sinuses are in the ethmoid bone. So you got one right here, this little circular gap, and then you see the little gap over here on the left side of the model. Those would all be ethmoid sinuses. And then you have maxillary sinuses out in the maxilla. That's one over here, and there's one over here. Watch it, because the meatus is underneath the concha. The sinus is a little more lateral. You see the maxillary sinus over here? Versus the inferior meatus, which is here underneath the concha. All right? So, excuse me. If you look at this, we're kind of halfway through the first column, right? We did these components of the nose, we did the paranasal sinuses, we did the nasal cavity, we did the meatus. I'm now going to show you the boundary between the nasal cavity and the pharynx, which is called the internal nares. If the external nares is where air enters, the internal nares, which is going to be bounded right about here, is the separation between the nasal cavity anteriorly and the pharynx posterior. So the way that you identify the internal nares is you have to look kind of in the area where all the nasal concha stop. Notice they all kind of end right about here. And that's going to be the internal nares. Now it is a hole, actually. But the reason it doesn't look like a hole on this two-dimensional image is because, number one, you can't tell that that model has depth. So it's going into the screen like the shape of a letter C. It curves in. But what's also missing is the nasal septum that would be sitting where you are. If you turn it and look at it like this, there's your hole, okay? So the internal nares is a hole. It just doesn't pop as much on the model because there's no, at least the image here, because there's no depth and there's no nasal septum. But in real life, there would be, all right?
So it's
this kind of like you would have to put a bracket from top to bottom
Okay.
right through here.
got it. That's the internal nares.
Yes. Okay, next up, we have the pharynx. The pharynx, one of the things you guys have to do is differentiate the three regions or sections. If they're being nice on the question, what they usually will write is identify this region of the throat. When you see throat, think pharynx, all right? Because the throat is anatomically the pharynx. The three sections are named for the space or cavity that they are at the posterior of. At the back of the nasal cavity, you have the nasopharynx. If you move down a little bit below, see this is the mouth or the oral cavity. So back here you have the oropharynx. And then right here, anteriorly, this is the larynx. We're going to talk about that in a few moments. But the larynx is here anteriorly. So posteriorly, right through this space, you will have laryngopharynx. Naso, oro, and laryngopharynx. You look at the structures list over here, you can see those all lined up for you. Naso, oro, and laryngopharynx. Now in the naso and oropharynx, you need to identify these four structures. So I'm going to show you where those are. Here in the nasopharynx, first you have the opening of the auditory tube, right at the tip of that point, that little depression. It would be a tube, it would be open in real life, but the plastic molding, this is the best they get. Here posteriorly, you have the pharyngeal tonsil. That's the pharyngeal tonsil, the posterior of the nasopharynx. Now, I'm only showing this on one model, but please appreciate the fact that you could also do this on the model here. Just because I'm not showing it here, doesn't mean you're not responsible for it here. The goal is to be able to identify it regardless of the model. So see how you have the opening of the auditory tube. There's the pharyngeal tonsil right here. So it's still there, maybe a slightly different presentation, but again, we're not memorizing models. You guys should be trying to understand what these structures are, and that's what you gotta work at, all right?
So the thing that looks like it could be a gland, that's the tonsil, the pharyngeal tonsil.
Right here?
Yeah.
Yeah. All right, as we move to the oropharynx, you would have the palatine tonsil, which is right there at the tip of the pointer. Palatine tonsil. And this is the tongue. You do have this, it's on your structures list from digestive system. But right there at the posterior of the tongue, you would have the lingual tonsil. Lingual tonsil. No associated structures with the laryngopharynx, and that pretty much gets us, I believe, through all of the items for the pharynx. Next, we have the larynx, also known as the voice box.